My intent is to be meaningfully helpful, and we are going to cover a topic that is very important. One that she rose in my life is my sister, and who was diagnosed a number of years ago, and she said, yes, finally, let's talk bone health. It's been a big concern, and it's particularly women on aromatase inhibitors or tamoxifen therapy, but particularly aromatase inhibitors. It's been estimated that 1 out of 5 women will suffer a bone fracture if it's not proactively addressed. So this is a chance to be proactive in this. Now, disclosure information is kind of, I have no commercial ties, aside from the fact that I happen to own a medical practice. All right, what are we talking about? We're talking about bone strength. You can see here that bone is not solid. It's more like a structural lattice framework, kind of like when you think about creating a building. It's not going to be solid. It's going to be structured in a way to optimize both flexibility in the wind and strength against other forces. But with osteoporosis, we can lose that structural integrity and making us more vulnerable. Our mission is to minimize that particular risk. So specifically, I'm hoping that we're going to be able to have insights that actually bone health is much more than a measure of bone mineral density. It's more than just a story of calcium. Second thing is we're going to cover today 3 nutritional factors that are critical for bone health and also have anti-cancer activity. And third issue is we're going to talk about 3 strategies to address. One is going to be nutritional, one is going to be exercise, one is going to be mind-body. We'll try to do all this in a reasonable amount of time. But first, I have to cover what exactly is out there and is known for medications. And Vista or raloxifene, exciting news about this is that actually the FDA has actually approved it as a preventative measure for development of breast cancer. But the big news has been the bisphosphonates. And originally it was kind of, we heard about Fosamax. Of all of these, zoledronic acid turned out to be the most important. Now, the American Society of Clinical Oncology, in their guidelines for optimal bone health, they say the evidence supports the use of zoledronic acid or clodronate. Now, clodronate is not available in the United States, so really the evidence base supports zoledronic acid, known as reclassed or Zometa. So the big exciting data from this comes from a study of nearly 12,000 postmenopausal women, and we can say, here are the headlines. Spoiler alert. Bisphosphonate therapy does reduce the rate of breast cancer recurrence and, also improves survival. Holy buckets, this is important. So what is exact data? And it's kind of, so nearly 12,000 women, we look at recurrence rates, possible reduction of 22%. Distant recurrence, we're talking about perhaps an 18% reduction. Bone recurrence, 28% reduction. Breast cancer mortality, 18% reduction with the use of a bone health supporting medication. Interesting. Now, those of you who know me know that I'm also concerned about informed consent and making sure that every decision is based upon an informed judgment. And so we have to consider what are side effect related issues. So there is esophageal irritation that can be addressed by working with gravity. Atypical femur fractures. Our femur, that major leg bone, the upper leg bone, that should be our strongest bone in the body. But there's a risk of bone fractures for that. There can be issues around whether there's enough kidney function. And the last one, osteonecrosis of the jaw. It sounds as bad as it is. But now, here's the thing. A lot of people have had root canals. Maybe you have had root canals. Root canals are now increasingly being recognized as a hidden abscess. And increasingly now, endodontists and other dental health professionals are using a new technology called CT cone beam scanning to look for hidden pockets of infection or other kinds of problems. If I had to go on one of these medications, I would insist on getting a CT cone beam scan before starting. No one wants osteonecrosis of the jaw, and lo and behold, there may be other reasons for that can be found through this testing that would result in better health. I can tell you on basic experience, seeing a lot of people with mystery illness, we have seen 2 people in the past year whose profound, long list of symptoms, whole body, went away just with treating a apical abscess diagnosed by a CT cone beam. The treatment was not a pill, the treatment was working with an endodontist and clearing that. Knocked me off my chair because, wow, 8 years of formal medical education and 30 years of practice, and no one's ever addressed dental health. Okay, so now I'm learning about dental health. All right, Prolia. A lot of people were asking about Prolia. Okay, it is approved, and it is kind of a backup agent if there's a reason for not doing a aromatase inhibitor or if it's not working. Prolia makes sense, and gosh, it can be really helpful if there's pain related with any kind of bone met. Now, I should also mention that the evidence to support Prolia is not as strong as with bisphosphonates, but it does represent a logical option, and many physicians will do it based on the collective professional consensus that exists at this time. One of the things that aromatase inhibitors, that is those medications which block estrogen production in postmenopausal women, one of the things that's really critical about this, the aromatase inhibitors is people describe severe arthralgia sometimes, so much so that people want to stop this potentially life-saving medication. I can tell you, rule number 1, vitamin D, vitamin D, vitamin D, make sure that the vitamin D is normal. Rule number 2 is if, despite having good vitamin D and there is significant pain, arthralgias, joint pains, particularly hand pains, talk with your doctor about low-dose naltrexone, N-A-L-T-R-E-X-O-N-E. Low-dose naltrexone. In a clinical trial conducted with Minnesota Oncology at Virginia Piper Cancer Institute, 20 women with severe arthralgias who want to go off their medications, 1 month on low-dose naltrexone cost $30. 1 month off comparison is kind of like women were able to continue, but kind of 3 shocking things. 1 woman canceled her hip replacement surgery. 1 woman canceled her knee replacement surgery, and a 3rd reported being able to garden on the ground for the first time in years. It's like, So, oh, and by the way, if you, when I presented this data to the leadership team of the National Cancer Institute's Experimental Therapeutics Committee, there's great interest in this. And that was 8 years ago. Where's the what's going on? This is medical sociology. We need a good medical sociologist to figure out how do we most effectively get well-funded clinical trials on things which are low cost, low toxicity, and potentially big bang for the buck. Hard to do, really hard to do.